All right, thank you so much everyone for joining us today. We will get started. I would just like to first introduce myself. I am Morgan Rumpf. I am the Deputy Public Information Officer here at the Middlesex Sheriff's Office. Again, thank you for joining us. Before we start, I did want to make a quick outline of what this virtual press conference will be. I would like to remind everyone that we will distribute audio and video of this full press conference as soon as the event concludes. First, you will be hearing from Sheriff Peter Koutoujian. He'll be followed by Dr. Andrew Clodney, and the Sheriff and Dr. Clodney will then take a few questions. Should you have any questions, we ask that you do submit them through our chat function, and we will try to get to as many of them as possible at the very end. Thank you so much, and now I will turn it over to Sheriff Koutoujian.
Thank you, Morgan, and to everyone for joining us this morning. Today, the opioid epidemic has not been alleviated by what is overtaking our nation, but it continues, and it's affecting every part of our Commonwealth. As Sheriff, I get to see the impact every day in the men who are in my custody, a third to almost 40% of whom require medical detox upon their arrival to our facility. These are fathers and sons and husbands and uncles and parents. They're always someone's loved ones, and they're our neighbors, and we here at the Middlesex Sheriff's Office are committed to helping them return to the community healthier than when they walked into our doors. I'm proud of the programming at the Middlesex Sheriff's Office. I believe, especially with my role in Major County Sheriffs of America, that it's among the best in the entire country. But I have always maintained and still maintain that you shouldn't have to come to jail to get access to good treatment. But if you are here, we want to make sure that you're receiving the best treatment and programming possible. With our nationally recognized medication-assisted treatment and directed opioid recovery program, or Matador, we believe we are doing just that here at the Middlesex Sheriff's Office. Not only offering treatment and programming inside, but pre-release planning that includes enrollment in mass health and appointments on the outside, and then the post-release support from our navigators. But we know that there is much more work to do because the community capacity to treat and the resources to treat and support individuals upon reentry must still be more resourced and strengthened. I look into the eyes of individuals preparing to leave our custody every day when I walk through our facility. And you can see that look in their eyes. Whereas a few weeks before they were about to leave, they were hopeful. But as they're about to leave, you can see their anxiety levels rising, and they're nervous because they're concerned about what will happen when they get back out. They're concerned about life on the outside. They're concerned about what resources will be available to help them get through those next few weeks and months as they reenter society and rejoin their families and their communities. The grant we're announcing today will help us enhance the support system available to these men by providing services to the people who love them the most, their own family members. The only ones who visited them, and you can ask anyone inside a facility, the only ones that visit them during their incarceration are their family members. These are the ones that care mostly, that mostly care, or the ones that really care about the incarcerated individual's well-being. And with this improved support system, we can better assist our incarcerated individuals, not only during their reentry, but as they prepare for that reentry while they are with us. We're proud to announce today that we've been awarded a $1.15 million federal grant by the Bureau of Justice Assistance to do this very work. This is a 3-year grant. It will help us really expand and enhance our Matador program, our MAT program. Our MAT program, Matador, is a public health response to a dual health and safety issue, and it is already making a difference in our communities. Amongst Matador participants who complete the 6 months of post-release treatment, only 13% had recidivated, demonstrating that drug-free really does mean crime-free, and that you're alive. With this grant, we will be able to launch the Involving Families in Treatment of Inmates with Opioid Use Disorder Project. This initiative will move us far beyond our traditional responsibility for those we serve and expand our focus to include the loved ones of those in our care and custody. These are the other victims of the crime, the families, the ones that are outside while their loved one is incarcerated, the ones that no one else thinks about and really no one else really cares about. But here at the Middlesex Sheriff's Office, we do care about not just those in our care, but their family members on the outside. With this, we will aim to improve outcomes for individuals and families by taking a more holistic approach to their needs, because we know this disease impacts more than only the individual, but all those who love them. This will help us build a better foundation for a long-lasting and successful reentry. The first step of this project will be implementing naloxone training and distribution for family members of incarcerated individuals with opioid use disorder. We intimately know the cycle of recovery and relapse as corrections professionals, probably more than most anyone. Our primary mission must be continuing to provide those in recovery and their loved ones with the necessary safety measures. We'll also build out a comprehensive family services program that will engage families in multiple ways, such as educational programs, family counseling and support groups facilitated by social workers. These efforts will help those we serve and their loved ones by enhancing coping skills, reducing stress, and improving mental health. As always, I am committed to having this process externally reviewed and measured. We are working with Brandeis University to conduct an evaluation of the project's impact in improving treatment outcomes and reducing the risk of overdose deaths. The involvement of Brandeis and Dr. Koutoujian will help us validate our work. I always say, everywhere I speak, vision without data is simply a hallucination, and I believe that to be very true today. Data is what has built Matador into a nationally recognized program, recognized by numerous organizations and publications as a best practice in the field, and data will continue to drive this project. The Involving Families in Treatment of Inmates with Opioid Use Disorder Project will build upon the foundation of two existing MSO initiatives, Matador and the Family Resource and Outreach Coordinator. Since Matador's establishment in 2015, more than 900 individuals have participated in the program. Today, nearly 420 people are actively participating in Matador, with 340 receiving care in the community and approximately 80 currently receiving care at our Middlesex Jail and House of Corrections. The Family Resources and Outreach Coordinator position was created earlier this year, and this is the first of its kind in the Commonwealth. In fact, we couldn't find a model across the nation that we could utilize to build what we were trying to do here. We checked with every organization, corrections professional organization across the country, simply couldn't find a model, so we created our model. And so this is what we've come up with. This is designed to support loved ones of incarcerated individuals through outreach and education, and to be a central point of contact for families with inquiries, requests, and importantly, concerns about not just them, but their loved ones. Not only does this help support those in the community, but it helps us better support and care for those inside our walls, in our custody, in our care. We saw the incredible importance of this position in the early days of the COVID response. This team responded to 145 inquiries between mid-March and mid-May, with issues ranging about concerns, regarding mental health and self-harm, to just want to check in, make sure that a loved one is being taken care of. And we were able to alleviate the concerns of those loved ones and look into the concerns to make sure that their loved one inside was healthy and strong. It has also been a valuable resource for our officers, another point of contact in our continuity of care, to ensure our incarcerated individuals are getting what they need out of their rehabilitation. Before I introduce Dr. Koutoujian, I want to take a moment to just thank a few people. I want to thank our entire Matador team and our medical staff and providers for their tremendous dedication. It's not just a job to these folks, it's a passion that they have, and they believe very much in everything that we do here and what they do for these individuals. Our community-based partners in Middlesex County and well beyond as we have built out our network, our state and federal colleagues who have supported our efforts, our fellow sheriffs around the nation that have not only looked to our program and replicated as a model, but those whose work has helped us strengthen our Matador over time. And lastly, to the program participants themselves, the men that have participated in these programs, they are why we do this. And their experience and their hope is what helped us tailor and refine this program to meet their needs. It's now my pleasure to introduce a recognized national leader in this field, Dr. Andrew Koutoujian. Dr. Koutoujian is the medical director of opioid policy research at the Heller School for Social Policy and Management. He has over 25 years of clinical, administrative, public health, and research experience, and many other academic appointments over the years. He specializes in the specifics of the opioid crisis, including opioid prescribing, naloxone programs, and addiction treatment, and is, if not the leading voice, one of the country's leading voices in speaking out against the opioid epidemic. He has testified before Congress. He has addressed the National Governors Association. He's been called on to share his expertise in forums across the country and in trials across the country. I have come to know Andrew through our shared advocacy locally and nationally for treatment resources. We both represent the two fields battling this crisis, public health and public safety. And this grant today is going to improve the health and safety of those we serve. Dr. Koutoujian, thank you for your leadership in this field, a field that many others don't pay much attention to. You know the importance of it. Thank you for joining us today and for your passionate work on behalf of this population. Doctor.
Thank you, Sheriff. Thank you for the kind words, and thank you for the work that you've done and your leadership in the field. I have to say that the past several months, really as the COVID crisis hit the country, for someone who's been working on the opioid crisis for many years, it's been very frustrating. And there's been a sense that the public and policymakers might not have the attention span for two public health crises occurring at the same time. And something we've seen is that as COVID hit, the opioid crisis, opioid mortality in the United States has actually gone up. The opioid crisis is getting worse. And yet it seems like less attention and less resources are really being directed to the opioid crisis, which is why I'm so pleased that Middlesex County Sheriff's Office took advantage of this federal funding to address the opioid crisis when it became available, because it was really when COVID was really beginning to peak in severity that this announcement for potential federal funding became available. And it would have been very easy for MSO to say, look, we've got our hands full right now with COVID. We're not going to be able to take time out to apply for federal funding, and the process is time consuming. It really does require a commitment. But Middlesex Sheriff's Office didn't do that. They said, look, we've got two problems here. We're going to address both, and with good reason. Middlesex County has one of the most severe opioid problems in the state of Massachusetts, and MSO is on the front line. About a third of the inmates are being detoxed, and the vast majority of these inmates are being detoxed from opioids. So again, I'm just thank you very much, Sheriff, for going after this funding and being obviously and being successful in obtaining the funding for this program. I want to say that when it comes to treating addiction, we're and when it comes to an evidence base for the treatment of addiction, we're really in our infancy. For many years, addiction was seen as a moral failing rather than as a disease or as a chronic disease. And since we are in our infancy, we don't really have that many tools in the box that have been proven to work. We have a few tools. There are a few evidence-based interventions that have been proven to be effective, proven to save lives. One of them involves the use of medications for treating addiction. And as we know, MSO was really ahead of the game in trying to see that inmates would have medication available to them for the treatment of their opioid addiction. And one of the other very few interventions that have been proven to work in the treatment of addiction is involving families in care. And there too, MSO had already begun addressing the need to involve families when this funding became available. And with this funding, what they've been able to do now is gain over $1 million to enhance the ability to involve families in care. And I should just clarify, when I say families, obviously I'm referring to parents, grandparents, children, but the term families really goes beyond that. For some individuals, they're elected families, their significant others, their close friends are their family. And this program is will include elected family members as well, not just traditional family members. Lastly, I just want to mention a little bit about what we do at Brandeis. Our Opioid Policy Research Collaborative is focused on studying interventions to address the opioid crisis so that we can figure out what works, what doesn't work, and get that information out to policymakers as quickly as possible. And so we're thrilled to have the opportunity to evaluate this program. We do believe that by demonstrating with data that this program works. And when we talk about working, when we talk about treating addiction or opioid addiction more effectively, we're talking about treating a life-threatening condition. So that means saving lives. And by getting the data to show that the intervention works, you have models that can be replicated across the country and can have a much broader impact. So we're thrilled to have this opportunity to participate. Thank you.
Thank you, Sheriff Koutoujian, and thank you, Dr. Kolodny. Now we're going to answer a couple questions. If you have questions, please drop them into the chat function and we will get to them momentarily. Our first question is from State House News. This is for Dr. Kolodny. Could you please speak to the unique challenges someone in recovery faces as they transition out of incarceration? Dr. Kolodny, you are muted. Thank you.
Sorry, thank you for the question. And I think that this actually, I appreciate getting the question, but I think this is also an area where the sheriff may have more expertise than I do. My expertise is in the treatment of opioid addiction, less so in the unique challenges for people who are leaving incarceration or being released. When we talk about being released in general, for individuals with opioid addiction, what that typically means is that they haven't been treated with any medication, and their addiction hasn't been well addressed, and they're being sent into the community without being plugged into appropriate resources, without their family knowledgeable about their condition, and they're extremely high risk for an overdose death. And we have very strong data showing us that one of the greatest risk factors for an opioid overdose is to have been recently released from incarceration. And so by treating people with medication, by making naloxone available, and by making it available to their families and teaching them how to use it, and by involving the families in treatment, you have a much better opportunity to improve outcomes.
Thank you, Doctor, and well said. I said it before, and I will reiterate it. I walk around that institution, and I speak with individuals that might be in there because of addiction-based criminologic factors. People should understand that just over 50% of our population have mental health issues or open mental health case with us. The acuity seems to be getting worse more recently, quite honestly. And with regard to opioids and stimulants, I think that one thing that's really important is, as I have spoken, and Andrew will know this, as we have spoken really around the country, probably, right? And Andrew, you can probably validate this if you wish, but you'd go elsewhere throughout the country, you'd be speaking to opioids, and there was plenty of opioid money, and then so many professionals around the rest of the country, especially in law enforcement, say, hey, I'm sick and tired of hearing about opioids. That's your problem up in Massachusetts, the Northeast, or certain sections. But in my area, it's not opioids, it's stimulants, right? It's meth that is really destroying lives and individuals. This is really important that this grant actually addresses both, because here in Massachusetts, we speak about opioids, but as Dr. Kolodny will say, we're seeing much more in the polysubstance abuse profile of those that are coming in. They're using many different drugs, not just opioids. They'll have fentanyl, they'll have meth, they'll have cocaine, they'll have other things in their system as well. So this is a polysubstance issue right now. And so this grant is thoughtfully, thinking ahead on that in a way that people haven't been. I will say, when I walk around that institution, I see hope in the eyes of those that are there. As I sit in there in sessions while they're getting programming, I can see their responses are healthy and normal. Quite honestly, when I go into some of the programming, and whether it's a parenting program or a relationship programming, I actually take something out of that myself and realized we should all be doing this type of programming for our own personal lives and families. But I can also see the hope in their eyes that many people don't get to see because they just want to be and live like everyone else or most other people in the community, but they haven't been able to figure a way to get there. And why is that? Because we do great programming inside, and here at Middlesex, we have reached that out further through our navigators and through our Matador program, where we're working with them on the outside as they reenter. This is going even further to work with the families to support them. But even with that, getting a job and getting a driver's license and having a car and just the, and maybe going to school or the things that they've always wanted to do, and then transitioning, really importantly, transitioning back into the family unit. They come away from a time out there, they come back into their home. If they have children, they get frustrated by what's going on. Their partner, their spouse will look at them saying, we were doing just fine while you were inside the facility, and here you're coming in and sort of, it's not fitting right? That's because we haven't prepared not just the individual in our care for their reentry as well as we could, but we haven't prepared the family for the individual to come back to them as well. And those families don't know how to keep their loved one healthy and alive. Here, we are allowing them that opportunity to keep their loved ones healthy and alive. If we can, this is like having a volunteer, really loving workforce that we can employ through educating these families and these as elected families, either families or elected families that Dr. Koutoujian was speaking about, in a way to support their loved one in a way that we can't, even with everything that we could possibly do, we can't. And by the way, as I said it before, when these individuals are in our care, they get some visitors. The only ones that visit them, you can ask anyone, the only ones that visit them are their family members, the ones to whom they are returning. These are the people that care enough to take time out to come to a facility like ours because they love that individual. These are the ones that are most committed to the successful reentry and health of the individuals in our care. These are the ones that we'll be able to work with to provide a better transition for the loved one in our care, but quite honestly, to support them in a way that no one has thought of supporting them. This will allow us to do that. And I look forward to Dr. Koutoujian's ideas, not just on the data, but the programming itself in a way that we be thoughtful about how we approach this and then be nimble about how we approach it as well.
Thank you, Sheriff. Thank you, Dr. Koutoujian. If you have any questions right now, please raise your hand or drop them in the chat function right now. If not, we will move on, but I will give it just a second so that anyone who may have a question has time to type it out. Okay. We have no further questions. Thank you all so much for joining us today. If there are any follow-up questions, please reach out and inquire with my colleague, Kevin Macchioli. Again, thank you so much for joining us today and have a great rest of your day.
Thank you very much, everyone.
Thank you.